The number of people being diagnosed with head or neck cancer in Oxfordshire has almost doubled in the last 10 years.
One of those is mouth cancer. It kills more people than cervical and testicular cancer combined. A startling fact, and yet many people are unaware of it.
Survivors in Oxford are using Mouth Cancer Awareness Week to attempt to change that, as Sally Mason explains.
Ralph Goodson was diagnosed with mouth cancer on his 51st birthday. A health-conscious marathon runner who has never smoked, he's not your typical candidate for the disease, and like around 50% of us, had never even heard of it.
Fortunately now, a bit further down the line, I'm enjoying a good quality of life again. It is different, it's not the same as it was, but the changes are a small price to pay, I think, for a cure. But the journey was hard.
The team at the John Radcliffe Hospital in Oxford are seeing almost double the number of people with head and neck cancer compared to 10 years ago. While excessive smoking and drinking increases the risk by 30 times and accounts for 3/4 of cases, a quarter of people now diagnosed are non-smokers and drinkers.
It's not just the fact that things are changing in terms of the numbers of people who are presenting, but the populations of people that we're seeing are changing as well. We're seeing a lot more younger people, we're seeing a lot more women, and we're seeing people who've traditionally not been typical head and neck cancer patients, i.e. those people who are not heavy smokers or heavy drinkers. And so something's changing about this disease, and it's not altogether understood why that's happening.
Researchers are looking into the links between the virus that causes glandular fever and mouth cancer. If caught early enough, survival rates are high, so the big threat is to the growing number of people who are not going to the dentist.
Because people are having difficulty getting access sometimes to a dental practitioner, and obviously some patients are presenting with tumours at a later stage. And from our point of view, from a clinician's point of view, the survival rates are much better with a smaller tumour. So if we're seeing people with later stages of tumours and larger tumours, then obviously not only survival is decreased, but also the surgery is more complex, the reconstruction is more complex, and the quality of life after surgery is also can be a problem.
So catching it early is the key. That's why Ralph and other survivors are doing all they can to get the message across to more people. Sally Mason at the John Radcliffe Hospital in Oxford for Thames Valley Tonight.